Hi everyone, my name is Georgia Gans, and today I will be demoing a proposed solution to a problem we hear a lot from our healthcare customers, and that is waste. Between recalled supplies, expired inventory, and rogue spending, an estimated $25 billion per year goes to waste in healthcare supply chains. We know how critical supply chains are in healthcare, so we know that this is a problem worth solving, and now I'll get into a quick demo of what a solution to this problem could look like. So I'll start by embodying the persona of someone who is a senior level director of procurement in a hospital network. And so in order to do my job effectively, I need visibility into stock levels across the entire network. So here we have a view into some of those stock levels and other key metrics for all of our locations. So this is like a bird's eye view into what's going on at all of our hospitals or at stock facilities like warehouses. We can see our percentage of expired inventory, our percentage of inventory that will expire in the next 7 days, and other key metrics. But because we have generative AI capabilities built into our product, we actually have the ability to tie the data that underlies this dashboard back to the clinical care perspective by providing a dialogue-based interaction for a planner in this hospital network. So let's say I want to know how much of my inventory is expired in terms of monetary value instead of just a percentage like we can see here. Without our proposed solution, that's going to take a number of clicks, some data aggregation, maybe even calling on a data analyst to get that information, all in order to generate some report to get an answer to my question. With our solution, though, this can be done simply by consulting with our supply chain copilot. So I'm going to ask it a question about our expired inventory. So we can see that it has queried the database and given me back a value of about $8.3 million. And to touch on the underlying functionality here, it's essentially a RAG model where our question hits an LLM that is hosted on Azure. The model has a vectorized version of our data schema, and it produces a SQL statement that is specific to my prompt and executes that against the database. So now maybe I want to drill down another level now that I have this number. Is all of this expired inventory concentrated in one location? Is it spread across multiple of my locations? Well, we can ask. So here I will now ask. Fantastic. So not only has it given me an answer here and told me the value of all of my expired inventory across my different locations, it's also given me this handy dandy visual so that I can very quickly see the balance across the network. So this is inventory that's already expired, but looking ahead, I'm also maybe concerned about what's going to expire. So we can also ask about the value of items that will expire over the next month. So this is letting me know that almost $30 million worth of inventory will expire over the next month. It has also given me a little graph here that is a bit verbose for what we currently need, but it's also giving me a chart here that tells me the name of all of the items that will expire for the date frame that I asked for. So it's giving me all the information that I need in a couple of different formats depending on what I need at this time. And we can also see that it's possible to download a CSV of this file to be able to do things with external tools. So now let's go back to our overall network view. So as I mentioned earlier, this is like a bird's eye view. It's very high level, but our technology does provide the ability to see this data with more granularity. So now I will act as if I am a mid-tier planner rather than a senior level planner or purchaser. What I need then is a look into a more local view of our inventory. So if I go into just our Boston facility here, we get a view of my out of stock, my expired inventory, and some other things that are specific to this singular location. But this is really more from the operations perspective. What about someone who cares more about care delivery? For someone like an OR nurse scheduler, we can look at our scheduled procedures. So now we have a 30-day view forward of all of our scheduled procedures, if we have the proper components to perform the procedure, and so on. So let's take a look at one of these that we are not prepared to perform. Just click on that first one. So we have this analysis. We can see exactly which items are missing and how much we would need to get. So we can see here we are missing a needle. 1 is required for this procedure, and we unfortunately have 0 available. We can also see different procedures that are competing for this particular material. So this is another procedure that is scheduled that also needs that material that's missing here. And in addition to that, we can see this related inventory that we might have at other locations. So for example, we have a couple of the items that we need here in one of our warehouses. So this could be an opportunity to collaborate with the team at that warehouse or maybe at one of our other hospitals in order to get that material where it is most needed in the most time-efficient way possible. But as we discussed earlier, expired or out-of-stock inventory is not always the only barrier to being able to perform a procedure. We also have to think about recalled items. So this is another thing that we can actually consult with our co-pilot for. So this tells me that yes, we have 2 product IDs associated with recalled products, and it also lets me know the volume that we have in stock of each and where those stocks exist. Again, gives me this data in a couple of different formats. So that concludes the demo. Just to wrap up,